My name is Niranjan Nayar, and today I'll be talking about fusion-guided ablation with Koelis ProMap focal therapy. Just a quick overview on Koelis and the technology they provide. They provide a 3D ultrasound that's capable of MRI and PET fusion. So the 3D ultrasound, it has a motorized transducer that takes a sweep of the entire prostate gland, and then it reconstructs the axial and coronal images. MRI and PET fusion, mainly used for prostate biopsies. They released a focal therapy software last June for planning and guiding ablative treatments with needles. And then there's obviously other transperineal procedures like rectal spacer and fiducial markers that they're compatible with. So they have proprietary organ-based tracking, and how it works is just that 3D ultrasound takes that sweep of the prostate, and then it saves that image, that capture with all the grayscale values. And so now every prospective scan is now matched back to that original scan. So if you can see on the bottom there, even if you scan 50, 60% of the prostate, it's able to match up those grayscale values to ensure accuracy. So onto focal therapy, obviously it's a multidimensional challenge. It starts with patient selection, right? Understanding which patients are viable for the treatment. Planning the treatment area effectively, whether it's MRI or ultrasound. We know there's a lot of efficient energies in the market today, so I think it's also important to have all those energies at your disposal because one size definitely doesn't fit all for focal therapy, so it's important to understand which energy goes with which treatment. Accurate guiding of that treatment, so needle-based therapy is making sure that that needle is getting to the right place and that index lesion is properly treated. And then of course follow-up, 6 months, 1 year down the line, monitoring that treatment outcome. So with the 3D map, of course you get the number and location of the MRI lesions, you make sure you get sufficient sampling of the index lesion, but also having the 3D map and the location of the systematic cores is also important to understanding if there's a core outside that index lesion that's positive, taking that into consideration when treating, the pathological results of each core, and then recording that treatment for further planning. Some advantages of the focal therapy software are superior targeting of that index lesion, the ability to contour organs and structures at risk, such as the urethra and the rectum, that may come in the way of your treatment, pre-planning to include a treatment margin past that index lesion, and then visualization of the predictive ablation areas. So they are able to provide the isotherm information for Galil, Endocare, cryoablation, IRE as well, to understand what that treatment area is going to look like before you actually insert the needles. And then of course traceability of the intervention. These are just a couple of pictures. So on the left here, transrectal biopsy was done. You can see the green cores are negative and the red cores are positive, and then a transperineal cryoablation was performed based on that 3D map. And on the right here, we have a hemiablation, transperineal biopsy performed, and then you can see that the isotherms are displayed here. So just a quick overview, pre and post MRI fusion. So patient selection in the past has always been done with a cognitive biopsy and based on the MRI. Planning is based on the MRI only. The guiding has been used with generic probe tracking technology instead of something that tracks the gland. And then follow-up biopsies, again, are done cognitively. Now, with the improvement of MRI fusion, the patient selection is done based on software-based targeting as well as having that 3D map and understanding where your systemic cores and your targeted cores are. Planning the treatment based on those biopsy locations, based on the pathology, customizing that treatment margin, making sure that the entire area of treatment is outlined, and then guiding that treatment and making sure that those needles, like I said, are coming to the right place regardless of deformation, regardless of whether you're able to see the entire gland with that ultrasound scan, making sure that you can actually guide those needles. And then following up by recording that intervention and biopsying the area of treatment based on that 3D map. So really quick, I just wanted to show a video. This is one of Dr. Kim's patients, a 59-year-old PSA density of 0.269. A PIRADS 5 extracapsular lesion was identified on MRI in the left base peripheral zone. An MRI fusion TP biopsy was performed. 4 targeted cores were taken that came back all positive, grade group 3. And then so this is basically just a video of the intervention. So here we have the prostate capsule outlined, the lesions demarcated. Now we're ready. So like I said, it's a 3D ultrasound probe. You make sure that you're in the center of the gland, you're able to see the Foley, and now you take this automatic sweep. It reconstructs the axial and coronal images, providing you with a 3D image, and you can see that lesion clear as day on ultrasound as well. So here, this is where that OBT comes in, right? We're telling the machine where those grayscale values are so it's able to match it up. So now we're also contouring the ultrasound for the MRI fusion. And then once we're done contouring the ultrasound, we can move on to contouring the structures such as the urethra and the rectum. So here we are contouring the urethra, and you can see the 3D model on the bottom right shows that information. The rectum's next. So visualization of the lesion, but also these structures, leads to a more effective treatment. So here we have the MR ultrasound fusion. We're looking for smooth delineation between the MR and ultrasound, and we can see that's pretty clear here. So once we confirm that, we'll see our lesion. And this is an ultrasound fusion based on the first biopsy. So this is what's going to show us that 3D map, right? So as soon as we confirm this, you'll see in that lesion, there'll be the targeted cores that appear. They're in red, so you can barely see them, but there they are right there. So if there's a core outside that lesion, being able to understand where that is when you're planning your treatment's pretty important. You can see the cores there. And then now we're going to plan our cryoablation. So the system's showing us the negative 40-degree isotherm in dark blue, the negative 20-degree isotherm in light blue, and so we're planning them not only in transverse, but also sagittally to make sure the depth is good. And because our 3D ultrasound probe has that motorized transducer, it tells you where to place those probes, so it takes the guessing out of it. So once we're happy with this, making sure we're outside of the structures, and these isotherms are showing max duty cycle at 10 minutes of freezing, right? So this is the max capacity. We're not gonna grow them this big, but we just know how big they're gonna get, and then that can help us when we're sculpting the ice ball, controlling the ice ball. So next, the system's going to tell us, okay, the first probe, based on what you planned, it should go into J6 or J5. So the needle's inserted. There's no manipulation of the probe. The probe's looking exactly in the slice that you need it to. Take your scan to mark the actual location of that probe to make sure that it's still in plan. So we're a little more lateral, but we're still covering that lesion. And once we're good with that, we go to the next probe. The next probe gets inserted. Once that's inserted, we review that plan, make sure things look good, and now we're just placing some thermocouplers in the external sphincter and the Danons. And after we're done with that, we can monitor the freeze. Cysto going on here, and then we monitor the freeze. So that's kind of the benefits that Koelis ProMap focal therapy offers, visualization of that index lesion, but also accurate planning and guiding of those ablative needles.